Thank you for that. And thank you all. It's a great pleasure to come back. It's always a pleasure to come back to the IOM and get an education. I come here to be educated rather than to educate. The slides you're going to see are not the global perspective on chemicals. They're a commission perspective. And they were prepared by my colleagues working in DG Environment and the Chemicals Agency, responsible for the REACH legislation. It tells their story. But in fact, I've been working on chemicals in the Commission for more than 20 years, including running the pesticides legislation. So I have my story to tell as well. And I'll basically be using their slides to hang my anecdotes on. So I won't necessarily follow exactly. I should say that through this 20 years, we have had a close cooperation with the US agencies, mainly the US EPA. In my current job, it's also with the FDA for pharma. But these are good conversations. These are healthy conversations. We have different perspectives, different backgrounds, different legislation and rules and so on that we work under. But I think there's an understanding on both sides that we just need to fit. And generally, I've always been very happy in my discussions with the US agencies in trying to find solutions and trying to find ways forward. Because in spite of the differences, we do in fact have many of the same challenges facing us. So this is as global, this is about the only global perspective you're going to get today. The value of maybe $3 trillion is the value of chemicals that go into what we call the technosphere each year on the global level. It's a huge industry in Europe, it's a huge industry here. Although China is increasing, I think, more than anybody else. And the growth in China has actually decreased our market share, but even in Europe, it's still increasing. There are many, many aspects to the life cycle. And up to now, we've been legislating processes or uses of chemicals. So it's very often that you'll see a given chemical actually being legislated for under different pieces of legislation. And when I was responsible for pesticides legislation, I remember REACH was first discussed, and I said, we want pesticides exempt because we have fantastic legislation. But in fact, there's a lot of co-formulants in there as well, and we didn't quite get that exemption. Same with pharma. My brother works for the pharma industry, and when I told him about 6 years ago I was thinking of moving over to the chemical sector, he said, then I'm going to have to change my name. Because those REACH colleagues, those bureaucrats in Brussels, are pretty high on the most hated list. Not just for the chemicals industry, but also specialized chemicals industries. So pharma don't just have to respect the pharma legislation, they also have to comply with REACH, REACH being fairly holistic. Against the background of the chemicals legislation, though, we also have additional pressures, political pressures on us. For example, WHO estimates 15 to 20% of all deaths in the EU are due to environment stressors. I'm not saying that they're chemicals, but chemicals are certainly part of it. And we have a strong political pressure to act to decrease pollution, water, air, and chemicals. This in addition to our existing chemicals legislation. And we need to think bigger picture, not just look at safety. And REACH, we were told, is the key to achieve this. Now, REACH, we started discussing REACH, I remember it must have been back in 99, 2000 or so, when the chemicals colleagues first started talking about REACH as a solution, because there was a problem, as Lynn pointed out earlier, there may be 80,000 plus chemicals out there, and we just had information on a few of them. An impact assessment was done in the early 2002, 2003, and basically said that the benefits that could be measured over a 30-year period would be about 25 billion euros, so that's what, $35 billion, just in terms of health benefits, and about the same for environment benefits. However, it also said that you will not see those benefits till at least 10 years into your program. So it's still early days. REACH was adopted in 2006, still early days. I remember the pesticides, the EU pesticides legislation, in contrast, was brought in 1991. There were 1,000 active substances on the market at that stage. And it was 1999 before the first decision on a substance was taken. It took that long to prepare the ground, lay out the framework, get industry to prepare the dossiers, and then evaluate the dossiers. That was in 1991. And basically, that it's done. For existing active substances, we're basically now through the list. And we have cut out, I think, about half of the active substances that were on the market in 1991 are now no longer on the market, but not necessarily for health and safety reasons. There are many substances which were produced in very low volumes that industry decided it's not worthwhile keeping them. It's not worthwhile investing in the process. So over the last 20 years, there has been that effect. REACH reverses the burden of proof. And this, again, is coming back to pesticides. The original pesticides legislation in the EU was from 1979. And the burden of proof was on the Commission. And we had to prove that the substance was unsafe. And in 25 years, we managed to do this for about 12 substances. And the decisions weren't even taken at Commission level. We had to make a proposal to the Council and the Parliament. So it would be as if Congress would have to take a decision on each substance. It was a heavy, heavy procedure. So for pesticides in 1991, we flipped it round and said, if you're not on a positive list by 2001, you're off the market. And suddenly everybody started scrambling. REACH is a bit of the same thing, but it's a quantum leap. It's a quantum leap when you look at the number of substances. It basically saves taxpayer dollars by putting the onus on industry to show safety. And in doing so, it also internalizes the environment and health costs of those chemicals. It also enables the authorities, because it's not the Commission that will control what's happening out in the field, it's the authorities in the member states. And they now, through REACH, have legislative powers to intervene, to set conditions, and so on. REACH itself finally came into being in 2006, entered into force in 2007, and it basically covers pretty much all aspects of all chemicals out there, not just chemicals on their own, but also in mixtures, in articles, and so on. It excluded from the scope food, cosmetics, medicinal products, medical devices, and so on. But there are aspects, Lynn mentioned packaging, for example. So those industries are also involved in it. The general idea was to improve health and safety for the environment, for consumers, for workers. And to maintain a competitive, innovative chemicals industry. And I'll come back to that in a moment. Why did we need it? Basically, we had no information or very little information on all the chemicals that were out there. The burden of proof was on us, and the decision-making was way too slow. The downstream users were not involved. So the producers tend to know about their substances they're producing, but the downstream users don't. And the system's inefficient. I mean, we had so much legislation all over the place. REACH consolidated and put that all into one framework. And then the administrative burden for new chemicals. Let me go back to downstream users not involved and give you an example from pesticides. We regulate pesticides, or agricultural chemicals, based on their uses, and there's a lot of bulk chemicals actually used as pesticides in low volumes. fairly simple molecules, and used in low amounts in agriculture. And they can be bought in bulk on the commodities market. But the producers of these chemicals, who maybe manufacture, hundreds of thousands of tons per year, have no interest in the low volumes being used in agriculture. And the users found themselves without the data, without the dossiers, and basically without the possibility to keep using them. Because the bigger industry, the production industry, was not interested, had maybe didn't even know these were being used as pesticides. So they came off the market, even though they may have been safe to use. Also, when I say preventing innovation, we had treated existing chemicals and new chemicals as different. So a lot of existing chemicals were sort of grandfathered in our legislation, but we had higher data requirements for new chemicals. And this prevented innovation in the chemicals market. Now we're basically saying all chemicals should be treated equally, and we're basically trying to promote substitution, innovation, and so on in the industry. REACH, as I said, was a quantum leap. Data gaps, I had mentioned all the different pieces of legislation, the different users and so on. They're now in the European Chemicals Agency, which was set up. They have created a data bank, and we make as much information public as possible and basically try to identify the gaps. The burden of proof used to be on public authorities. Now it's on industry. We save tax dollars and so on. The downstream users are not involved. Was a problem. But now we're basically saying everybody should be involved. And again, I come back to the pesticides. We had, say, for a generic pesticide, say like glyphosate, 44 different companies notified us that they wanted to defend glyphosate and keep it on the market. The smaller companies couldn't afford to generate the data. The larger companies were saying, we're not giving it to you. We're not giving you access to the dossier. And this is one example, but there are many examples of pesticides where the larger industries who could afford it and did have the data did not negotiate in good faith with the smaller companies and used the legislation to drive the smaller companies out of the market. We had a lot of discussions on this, a lot of problems. And when REACH was being discussed, how is this going to happen? We said, no, they said, I know, let's force the companies to speak to each other and to produce one dossier. And our viewpoint was, good luck. Good luck. And in fact, this is one of the biggest challenges that we have with REACH, is how to get everybody to cooperate. Prioritization, I won't go into prioritization. Evaluation, it provides for authorization. Implementation, and enforcement. I don't have time to go through all these, but basically we did a review of REACH in 2013, and this is available on the internet. It basically describes where the problems are as we see them at this time and what are possible solutions. And one of the conclusions was it actually functions well. It's delivering on all the objectives in the time frame so far. There are needs for adjustments, so the legislation does need to be balanced, changed, tweaked, and so on. But given the preference of industry to have a stable regulatory environment, we're actually not planning to make any major legislative, even minor legislative changes to it. There was a big impact on small to medium enterprises. A lot of them cannot access the dossiers. A lot of them don't have the money to invest in dossiers. A lot of them don't even know about REACH, in spite of our outreach and so on. So there's a lot of investment going on, reaching out to those small manufacturers. And yes, there are other opportunities for further improvement at all levels, but well, commitment of all is involved. It's too early yet to quantify the benefits to the environment and to health, but we do see positive trends in the sense that companies are looking for safer alternatives because they know there will be problems down the road when their substances start being reviewed. Increased moves towards substances of severe SVCH, high concern. I can't remember what the SV is, but very high concern. Substances of very high concern, that's it. Yes. There are also science issues involved, science problems that need to be sorted out. Endocrine disruptors is one. Mixtures is another. I'm sure there's more, but these are the two that strike me immediately. And in January 2015, we will be bringing forward proposals for new data requirements. That's it. I hope I stayed within the time. I could have said a lot more, but we'll have time maybe during the discussion. Thank you.
Okay, next up to give us a U.S. federal perspective is Ms. Wendy Cleland-Hamnett. Wendy is the Director of the Office of Pollution Prevention and Toxics in the Office of Chemical Safety and Pollution Prevention at the U.S. EPA. She's served in this position since 2009 and as Deputy of the Office several years before that. As the Director, Wendy oversees EPA's new and existing chemicals programs, numerous safer chemical and pollution prevention activities, and enhanced efforts to make chemical information more accessible to the public. Welcome.